The World Health Organization was founded on 7th April 1948, a date commemorated every year as World Health Day. WHO has more than 7,000 people working in 190 countries. They work at the WHO headquarters in Geneva, in the 6 regional offices and in over 150 country offices. There are 3 governing bodies of WHO: the World Health Assembly, the Executive Board, and the Regional Committee that carries out the decisions of the Health Assembly and of the Executive Board within the region.
WHO is a global health agency that builds the health of the people. And we work with governments, with all member states, including Uganda. In Uganda, WHO started operation in 1964 when the cooperation, the bilateral cooperation was signed by the government and the World Health Organization.
I found WHO to be a very dynamic and important member of the United Nations system in Uganda. We have close to 20 UN agencies, funds, and programs present or contributing to Uganda's development. WHO is really important from 2 standpoints. The first is in terms of knowledge. Has an incredible background in terms of knowledge on how do you mainstream well-being and how do you make sure that the well-being of people is at the forefront of any development that we do. And at a time that we're promoting the 2030 agenda, which is supposed to be people-centered, I see WHO as really a fundamental player and enabling us to make sure that everything we do in terms of developing the people and the planet takes in consideration the well-being of the people.
In countries, World Health Organization staff work side by side with the government counterparts and partners to deliver the mandate and mission of the organization.
Every country globally, including Uganda, needs WHO to provide what we call the normative guidance for managing diseases. And so in the case of Uganda and the health sector in Uganda, WHO is a principal partner of the Ministry of Health and other related agencies to make sure that everything to do with the management of diseases in Uganda has the required technical assurance from WHO. So in that respect, WHO is an indispensable player for any government and for any Ministry of Health.
Overall, WHO's objective is the attainment and enjoyment by all people of the highest possible level of health without distinction of race, gender, religion, political belief, economic or social condition.
WHO has been in Uganda for 52 years. That means it has successfully managed to be fit for purpose over the period of Uganda's existence. I believe that the fact that Uganda has a very strong epidemiological response is testimony to the collaboration, the partnership that it has had over the years with WHO.
The support WHO provided to Uganda and other partners over these years has enabled the government to achieve significant milestones, and we believe that this will continue in a more systematic way.
World Health Organization directs and coordinates international public health within the United Nations system. This is done by providing leadership on matters critical to health, shaping the research agenda and stimulating the generation, translation and dissemination of valuable knowledge, setting norms and standards and promoting and monitoring their implementation, providing technical support, catalyzing change and building sustainable institutional capacity, and monitoring the health situation and assessing health trends. So what does the World Health Organization mean to the ordinary Ugandan?
services, including immunization and treating various epidemics. One thing I know about World Health Organization is strategy for 7 April 2028 and science agency that partners with the government to help prevent mothers, small children, and also intervene to early outcomes.
The work of World Health Organization at country level to meet the expectations of such people is guided by World Health Organization Country Cooperation Strategy. This is a medium-term strategic document that defines a broad strategic framework for World Health Organization's work with the member states.
WHO provides technical support through what we call country cooperation strategy. This is a midterm, a 5-year plan, a strategic plan that is developed based on internal consultation with the government, Ministry of Health mainly, and other sectors, as well as partners operating in health in country. It clarifies the strategy and the vision that we have during that period, and also is aligned to government plans and policies, as well as the United Nations Development Assistance Framework.
For Uganda, we have implemented 2 such strategies before, and this one for 2016 to 2020 is the 3rd one, and it's building on the foundation laid by the previous 2 country cooperation strategies.
The Country Cooperation Strategy provides the strategic direction for WHO in Uganda to advance the National Health Development Agenda for the next 5 years.
The development of the Country Cooperation Strategy was very participatory. Ministry of Health was involved all steps of the way.
But also with very wide consultations with the senior level decision makers from government, UN agencies, development partners, NGOs, and civil society organizations.
It also provides a framework for WHO's biennial work plans and budgets. In addition, it provides an institutional framework within which World Health Organization in Uganda functions and collaborates with the other level of the organization, the UN, and other development partners.
During this period of the CCS2, WHO supported government alongside other partners in the agreed areas of cooperation, and several key achievements were made. We had policy and guidelines development, where WHO supported development and implementation of the National Health Sector Strategic and Investment Plan 3. For example, in HIV, access to antiretroviral therapy was increased significantly through training and accreditation of national health facilities with the support of WHO. We saw the increase in accredited ART centers from 475 in 2011 to over 1,600 by June 2014. WHO also supported the scale-up of elimination of mother-to-child transmission. We also supported the scaling up of safe male circumcision as part of the combination prevention package in Uganda. In malaria, WHO supported, alongside other partners, the country to develop a malaria reduction strategic plan, which goes from 2014 to 2020. In immunization, with support from WHO and other partners, Uganda has achieved 3 of the 6 specific targets of the Global Vaccine Action Plan. And notably, these are that Uganda has reached and sustained 0 cases of wild polio and was certified as polio-free, has achieved maternal and neonatal tetanus elimination, and also introduced new vaccines, including pneumococcal conjugate vaccine and also human papilloma virus vaccine. In the area of neglected tropical diseases, Uganda was certified guinea-worm-free in 2009 and has maintained this status since then with support from WHO for post-certification surveillance. And Uganda also was supported by WHO to develop and launch a master plan for elimination of NTDs in Uganda by 2020. So far, onchocerciasis is eliminated in 14 out of 34 endemic districts, trachoma eliminated from 19 out of 40 endemic districts, and lymphatic filariasis from 16 out of 55 endemic districts. WHO supported the government to implement the first ever nationwide non-communicable risk factor survey. And the data has been collected and is used to guide policy formulation and multi-sectoral planning for NCD prevention. So with this data now, we are armed with the information that we need to implement a multi-sectoral response to public health events.
The third World Health Organization Country Cooperation Strategy has 5 strategic priority areas of cooperation with Uganda to be attained by 2020.
This third generation CCS builds on the successes highlighted in the second generation CCS and aims to further contribute to improved health outcomes for the people of Uganda. With close collaboration and support from all the partners and stakeholders, we hope that this CCS3 will enable us to contribute yet again to the government's public health commitments and to strengthen health systems for universal health coverage.
The country cooperation strategy will be implemented within the context of domestication of sustainable development goals, universal health coverage, the Vision 2040 and United National Development Assistance Framework 2016 to 2020. Emerging health including non-communicable diseases, climate change, population increase and urbanization will have to be addressed.
One of the focus areas will be, of course, the issue of non-communicable diseases. I believe this is one area where the WHO can take up and will take up, I hope, a leadership role. The burden of the non-communicable diseases in Uganda is rising, and it really becomes a problem for Uganda, not only in terms of disease burden, but as well financially.
Therefore, working together with the World Health Organization, the Ministry of Health will be able to address most of the issues that still pose challenges to the Ministry of Health. I therefore want to congratulate the World Health Organization upon the completion of this document, and together we pledge that we shall implement this document to ensure that the health of Ugandans are improved on.
I would like to take this opportunity to thank all colleagues that have worked on it, government, particularly the Ministry of Health and particularly the Minister herself, for their engagement and support in the process of identifying the priorities and also framing the way it should be framed in the document itself. I would like also to thank partners that showed up and give us valuable contribution in the process, and also the staff who have committed themselves to develop it, adjust it accordingly during the internal consultation, and also brought it to the final stage, which is now one of the internal documents that is being referred to by other countries. I thank all of you who have done a wonderful job in bringing this to fruition. Thank you.